A special committee to support efforts to ensure a safe and effective transition to normality has been launched here in the country. For more on these efforts, I have Professor Kim Moon-gyu from Yonsei University. Welcome back, Professor Kim.
Thank you for having me.
And I also have Professor Sarah Ok-shin from Korea University. It's been a while, Professor Shin.
Yeah, pleasure to be back.
Right, Professor Kim, we'll start with you then. The daily tally has been hovering below the 2,000 mark in recent days. What is your assessment of the current COVID-19 situation here on the local front?
I'm very optimistic, if we look at a 7-day average of our confirmed cases, it showed a peak in the end of September, and after that it started to decline. And since we are making average of 1 week, it's a very powerful number. That means that it's going to decline, and we have to watch for 1 or 2 weeks more. But I think it's a good sign that the confirmed case is declining slowly. But still, we have to be vigilant against any new variant emerging. That's the point that I want to mention.
Right, and talking about vigilance, Professor Shin, there are some people though who are talking about the possibility of seeing 5,000 new cases per day later this month. In the case of greater travel to mark the autumn season, what are your prospects?
Well, so as Dr. Kim has mentioned, that the numbers of infected cases are slightly increasing over the weekend, but it's not exponential surge. So we have to be still very vigilant, because when we think about what happened during Chuseok holiday, we have seen, the numbers of infected cases exceeding 3,000 cases right after Chuseok holiday, and that was still under, level 4 social distancing rules. And so we just had 2 consecutive long weekends, and we have seen increased levels of people moving around and mingling, going out of town for vacations. So the increased movement of people definitely means, the numbers of infected cases might go up. So there's a possibility that we might see, the numbers of cases to go up within a couple of days, given the incubation period of COVID-19 variants. As a reminder, although we are seeing much less cases with severity or mortality with increasing vaccination rate, the government just started, setting up the transition committee, and we just started talking about the roadmap for living with coronaviruses. So until we have detailed long-term plans, I think we still have to keep the infected cases down so that, our medical system can handle, these numbers of infections.
Right, and speaking about infections, Professor Kim, 1 out of every 5 new cases has been found to be a breakthrough infection. How do you explain this finding? And do you believe breakthrough infections may perhaps pose a greater challenge to containment efforts?
Somehow it's going to be challenging. If we look at the breakthrough infection in September, it is increasing by week from 10% to about 20% right now. And if this result come with a decline of cases, we have to search for many possibilities, reasons for this. And for the recent 2 weeks, people more than 80 years showed the highest breakthrough infection, which is about 74%, and it's much higher than younger age group. So that might be explained by 2 ways. That one is, it might be the evidence that we need a booster for elderly people because their immunity is declining day by day. And the other possibility is that this age group might have started to loosening their social distancing because they are too confident about their immunity against COVID-19. So we have to look at both ways, but I would like to mention 2 countries right now. One is Singapore. Now they have very exponential increase in cases right now. It's much more higher than US, UK, whatever. And already 83% of their population is vaccinated. And among the confirmed cases, more than 98% are asymptomatic or very mild. And the patients who need oxygen is about 1%, and the patient who need ICU care is about 0.1%. It's very low. And about half of the confirmed cases are already vaccinated. I mean, it's much more higher than 20% of Korea. So if we are going to make a policy to live with COVID-19, if we want to give up a COVID zero policy, we have to watch what is happening in Singapore and learn lessons from them. The second country I would like to mention is Israel. I think they are one of the first countries to start booster shots for the vaccine people. And they had a very high surge in the late August, and now they are declining. I think they are giving the booster shots with some kind of quarantine measures. And if we follow up these two countries, I think our government will be much more easy to make our own policy.
Right. Professor Shin, as Professor Kim mentioned, in Singapore, 83% of the population there is fully inoculated. Now, earlier on in the pandemic, we spoke about how 70% of the population being vaccinated would offer us with a threshold for herd immunity. What are your thoughts on this now, herd immunity?
Well, so the 70% vaccination completion rate was actually given by the government when we had very low reproduction number. Which is determined by many different variables, but we know now that with the emergence of variant viruses, this reproduction number has increased quite a bit. So, in my opinion, the herd immunity is no longer, an option for us, especially even if we get every single one of us gets the vaccination completed. Realistically speaking, we already began talking about coexisting with COVID-19. So in near future, COVID-19 will be treated just like the flu, common cold flu. So for us right now, I think just a game changer is going to be finding an acceptable and highly effective antiviral drug like Monuvir that we'll talk about in the discussion later.
Right, that is the case. Meanwhile, elsewhere, it's been almost 3 months since authorities in England declared freedom from pandemic-related restrictions, but their fight against COVID-19 infections continues. Now, for a glimpse of the situation there, I have Dr. Mark Jitt at the London School of Hygiene and Tropical Medicine. Dr. Jitt, it's a pleasure to see you again.
Great to be here.
Right. Now, Dr. Jitt, the UK recorded over 40,000 new infections last Thursday for the first time since early September. And again, this past Monday, the daily tally hit above that level. What more can you tell us about the COVID-19 situation there?
I think the number of cases in the UK has been pretty stable since July. There's been about 30 to 40,000 cases every day. The surprising thing is not that it stayed high, but that it hasn't gone up further. The reason is because in July, almost all COVID restrictions in the UK were lifted. So there are almost no restrictions on going out, on economic activities, on mass gatherings, on face coverings, and so forth. So I think the reason cases haven't gone up despite the removal of all restrictions is really because of vaccination, because of the fairly high vaccine coverage is what is preventing cases from increasing. But since we've gone back to almost like a pre-COVID levels of restrictions, I think that is what's stopping the numbers from going down. I'd add that the number of deaths is it's lower than it's been with previous waves, and that's because most of the older and most vulnerable people have been vaccinated with 2 doses.
Right. And talking about vaccination, Dr. Jitt, healthy children aged 12 to 15 over in the UK are being offered 1 dose of the Pfizer vaccine since late last month. Now, what is behind the decision to offer a single dose to those in this age group?
Well, the reason for that is there were some risk calculations done on the individual risk of the individual benefit from vaccination versus the risk of a very, very rare possible side effect of vaccination in children, which is myocarditis. I would stress that this is a very rare event. There's less than, maybe one case per 100,000 or even less where this happens. But if you base it on individual risk calculations, then the first dose gives the most benefit and has the very, very low risk of myocarditis. The second dose gives less extra benefit because most of the protection comes from the first dose, and then has a higher risk of myocarditis. I mean, I do want to stress this is a very rare event, and the calculations that were made don't take into account other benefits, which I think possibly governments might also want to consider. For instance, helping the adolescents, the teenagers who get vaccinated, preventing them from missing school if they get sick or their friends get sick, preventing transmission in the community, preventing so-called milder cases of COVID, which can still be quite severe in some cases and maybe lead to long COVID. So I think if you take those into account, I can see why other governments have recommended 2 doses.
Right. Meanwhile, Professor Kim, as part of efforts to ensure a gradual return to normality, authorities here are expanding at-home treatment. Now, for those who have mild or no symptoms, what can be done to further support this treatment at home?
I guess some patient will welcome that decision to let them stay at home, and some people might be worried about their health situations. And for the patients, I mean, they should be compliant. I mean, they should follow the rules that the government is giving for their quarantine measures. And if the patient have some kind of comorbidity, or if the patient is in a situation needing a caregiver, we have to think one more time whether to let the patient stay at home or rather do as we did previously. And I guess they might need some kind of personal equipment which they can use at home, such as a small device checking the oxygen saturation, which is very cheap and available right now. For the government side, I think they have to use the beds available. I mean, we have a network of facilities that communicate to admit patient, and it should be work very efficiently. Sometimes it doesn't work out pretty well, but if more patients going to happen, and if they have to stay at home, and somebody might get worse, and we have to be ready, so more beds should be available.
Right. And Dr. Jit, what can you share with us about making effective use of at-home treatment, which I hear is an active option over in the UK?
Yeah, well, the policy on home treatment has been the policy actually since the beginning of the pandemic, almost the beginning of the pandemic. Most, cases of COVID are recommended to self-isolate at home and only to seek care if they're supposed to monitor their own symptoms and then to seek care if the symptoms worsen. The reason for this is the vast majority of cases of COVID will improve without any hospital treatment. So this both allows patients to self-isolate at home and prevents the hospital facilities from being overwhelmed. So, yeah.
Right. All right, Dr. Jit, as always, thank you for making the time to join us live at this very early hour at your end.
Great to be here. Thank you.
Right. And Professor Kim, now going back to what Professor Shin mentioned earlier about Merck's antiviral COVID-19 pill, could you remind us a bit about its efficacy? Because we've touched upon it quite a bit.
Yeah, it's a little bit early to talk about it because we don't have many information about it. Anyway, this new drug named Monuvir, it inhibits the viral replication because the structure resembles the materials that the virus needs, and it can go in to make when they make their own RNA, and that RNA doesn't work properly, so the virus is going to die. And it does not target the spike protein, so it might not be dependent on a new variant, which is a good news. Clinical trial ended prematurely because the benefit was clear with this new drug, so which is a good news. This study included more than 700 subjects, and the admission rate with the people who got this medication was only 7%, while the compared placebo group was about 14%. 14%, which is 2 times higher. And I would like to compare with Tamiflu, which we had at the influenza outbreak in 2009. Molnupiravir is effective if it's administered orally within 5 days of symptom onset, which is almost the same as Tamiflu. And side effects, there's no safety profile for pregnancy right now. And during the clinical study, they prohibited any unprotected sex for a week after finishing this medication. So this is something we have to take care about. And I would like to go to the price issue. I cannot talk about the price in Korea right now because we don't have it. But for Tamiflu, it takes about $150 to finish the 5-day course, about 10 pills. But the price of Molnupiravir is very shocking. I mean, you have to take 8 pills a day for 5 days. Totally, you have to take 40 pills for a course. And there is a drug price expert in Harvard University. They say it's enough for $17. But the company, Merck, says they're going to charge $700. So it's going to take about $3,000 per course. So even though we have that medicine, if the price is too high, it's going to be very difficult to use it in a large scale.
Because most people will not be able to afford it.
Yeah. So vaccine is going to still be necessary even though we have this medication. So that's the thing we have to remember.
Right. And staying with this drug, Professor Shin, 2 Indian drug makers are looking to end late-stage trials of their generic versions of Merck's Molnupiravir to treat moderate COVID-19. Could you tell us a bit about this event and its implications?
Yeah, so 2 Indian companies independently tested genetic form of Molnupiravir in people with moderate disease, they claim, but they dropped the trials because they saw no significant efficacy in these people. Although they do say that they will plan to continue the clinical trials for people with mild illness. So, why there's no high efficacy, you might ask. So spokesman for Merck points out that these clinical trials that Indian companies ran actually included people who have been defined as more severe than moderate. So in terms of, so they have different criteria or different degree of severity for people with the severe symptoms versus moderate symptoms. So maybe the Indian clinical trials include more severe cases, so maybe that's why they didn't see much more effect than we expected. Mm-hmm. But anyway, nonetheless, as I mentioned before, I think this pill could be a game changer. Although Dr. Kim has mentioned that it has some issues with the price. Right. But I can definitely, decrease the severity and death significantly. So I think an effective oral drug could be an incredible asset against the fight against the COVID-19, for sure.
Right. And Professor Kim, what are your thoughts now? We've started offering booster shots and they're being offered to medical healthcare experts on the front lines of the pandemic. What are your thoughts now on the timing of booster shots for the elderly? Because initially for the inoculation, we made the elderly a priority, but they seem to have been pushed behind healthcare workers. What are your thoughts on this?
Well, it's very hard to say which has more priority. Health officials, yeah, they need booster shots, and elderly people, yeah, definitely they need it. Well, I would say that both of them should be immune against COVID-19 until the end of this pandemic. And well, if we look at the elderly people, if you are more than 60 years of age, you have a more high rate of breakthrough infection. And in Korea, about half of the breakthrough infections, they are all more than 60 years of age. So definitely we're going to need that. I don't know the recent data, but in August, we had a screening test for the antibody positive rate in our population, which was very low at that time, about 0.3 to 0.5 among our Korean people. And since we had vaccination started and there are more confirmed cases, it's going to be much more higher. But this high-risk group, if they got infected, they're going to go to ICU. So definitely they're going to need some kind of booster shots. And for medical personnel, even though our government will ease the quarantine measures, the hospital has to stay with some strict rules for some time, because we don't want any nosocomial infection happening inside hospital.
Of course not. Right, Professor Kim, as always, thank you very much for your thoughts. And
Thank you.
Professor Shin, thank you for being with us today.
Thank you.